Yeah. So, ma'am, so tell us what is hair fall? What are all the causative triggering factors for hair fall? What are all the age group who are commonly affected with hair fall? And what are all the other disease conditions which triggers more hair fall and all? And thereby, what are all the treatment management can be taken to prevent hair fall and all, ma'am? Yeah.
So, like you rightly mentioned, the hair fall it's a very common problem these days.
Yeah.
It's both males and females. We are
Yes.
seeing many people who are getting stressed because of hair fall, and then they are coming to us saying, "I'm so scared." I have heard this complaint many times from many patients. My hair is falling at such fast rate. I think I'm going to become bald in the next 1 year.
Yeah.
So they feel that I'm having so much hair fall. They bring the hair also.
Yeah.
When they're washing their hair, they put it in a cover and they bring it and they show us to make us believe that that they are having so much hair fall. They're getting so tensed about it.
Yeah.
We are seeing this in all age groups.
Yes.
Even in school going children, parents are bringing the children saying they are having hair fall. Even elderly adults, mid 40s, 50s, and especially in this teenage years, these boys, this 19 to 30 years, males also, we are getting many with hair complaints of hair fall.
Yeah.
So what we need to understand is there are two different types of hair fall. So one is which is temporary. That is, it is a some sort of acute process is happening, and because of that, as a reaction of that, they are having hair fall.
So that
and
is
there are some
modifiable.
conditions that is modifiable and easily recoverable.
Okay.
That is, it's only temporary because of some few causes which I will be discussing.
Okay.
And then there are some conditions where the hair loss is permanent. That is, the hair follicles are completely destroyed permanently.
Okay.
So those cases are mostly because of some underlying disease.
Okay.
There are some, like for example, SLE, one condition like TLE. Those are few specific skin disorders which targets the hair follicles in the scalp, and the hair follicles are completely destroyed.
Okay.
So in those cases, they should take medicate that area where they've lost the hair. It is difficult for regrowth to occur. But what we can do is identify the cause, give them certain medications, mostly oral medications, to stop the disease process so that they will not be having any further hair loss.
Yeah.
So that is what we call, in simpler terms, I'm saying temporary and permanent.
Okay.
So the common, so you need to identify that first. Okay. And then secondly, whether the hair fall is diffuse or it is patchy. Okay. So patches, there are few patients who have patches of hair fall, like round patches where there is complete loss of hair. So that commonly can be because of one condition known as alopecia areata, which is an autoimmune disorder where the body's own immune system is attacking the hair follicles, and so there is loss of hair in that area. But the good thing is it is a temporary condition. It can be treated. Hair growth will definitely occur in the patch if adequate proper treatment is taken. So that is one common cause, and this is very commonly we see in children, especially commonly school going children. Adults also we see, but in children we commonly see this alopecia areata where there are patches of hair loss. So that is nothing to worry. People think it is communicable, it is transmissible. They try to they avoid the child. In school also they make this child sit separately. I have had patients who have complained of those things. Okay. So that is it is a individual process. It does not spread from person to person. Okay. There is another condition, like I mentioned, fungal infection, right? So fungal infection can occur on the scalp also. So when it occurs on the scalp, that time also it can cause patches of hair loss. Okay. So that is communicable. So they should not use the same comb, towels and all those things. Again, for that also we need to give appropriate antifungal therapy, with which it will be completely, it will improve. But again, if it's not treated early, if it's in the last stage, you come in the very late stage, that time sometimes the process becomes irreversible. So the hair growth again may be difficult to stimulate in that particular area. Yeah. So these are the common causes for the temporary hair loss. I mean, patches of hair loss, especially in children. Okay. So both these conditions we commonly see in children. Though alopecia areata we see in adults also. Okay. So that is something, but in both cases it is treatable, it is curable. So you need to identify, go to a specialist, get it diagnosed, what is the cause for that patch, and then get treated. So with that it will recover. So no, you do not have to worry about it. Okay. There is another condition where diffuse hair fall is there. That is, patients complain that I'm just losing hair all over. There are no specific patches, but either the hair thinning may be present, hair density will be reduced,
Okay.
Overall, all over the scalp, there will be hair loss. So they'll say the thickness has come down. Before when I used to put a ponytail, it was very thick. Now it has become, the volume has become very less.
Yeah.
So these are the common complaints which you get, especially in females.
Yeah.
So this is something which is very, most cases it is temporary only. So we need to identify the underlying cause which is responsible for this hair loss. So in females, especially in females, the most common cause is nutritional deficiency.
Okay.
Predominantly iron deficiency, because during menstruation there is blood loss, and even otherwise, there may be other like worm infestations.
Okay.
Some causes of iron deficiency anemia. So those are the things. The iron deficiency anemia is one very common cause of this diffuse hair fall. I have diagnosed many patients with anemia just when they presented with just hair fall.
Okay.
So we do a basic investigation to identify whether it is secondary to any nutrition deficiency. So one of the first things which we do is check for the hemoglobin levels and the iron. If necessary, we can do a peripheral smear to identify if there is any features of iron deficiency. So low iron stores also is a common cause.
Okay.
So this is again completely recoverable once you start the patient on iron supplementations, improve the hemoglobin level, the hair fall will reduce and the hair growth will start continuing as before. But again, this takes time because the hair cycle at least is 6 to 9 months period.
Okay.
So for the hair cycle to, completely regrow. So for it to start coming from the hair follicle.
Okay.
So you need to give it time. Though it is temporary, it may take a few months for the recovery process to be visible actually.
Okay.
So apart from this, you have protein deficiency. Other minerals and vitamin deficiencies also can result in hair fall. Even vitamin D deficiency can cause thinning of hair and hair fall.
Okay.
So we need to analyze if there is any underlying nutritional cause, and then treat the appropriate deficiency. So that which will again, because simply using shampoos and these lotions on the scalp when you're not treating the underlying cause is not going to help. Because shampoos and shampoos especially, people are marketing many shampoos, anti-hair fall shampoo. This will reduce the hair fall. This will increase the volume of the hair. That is not true. That is just a marketing gimmick, because the shampoo's action is just to cleanse the hair, clean the hair.
Yes.
If you're having dandruff, medicated shampoos will work. If you're having lice infestation, for that you have medicated shampoos. Fungal infection, you have medicated shampoos. So those are some conditions where shampoo actually helps. But hair fall is not one condition where the shampoo is going to play a major role. We have many patients who come and say, what shampoo should I use? I'm having hair fall. So you need to first identify the cause. Okay. Rather than using these shampoos. They're all very expensive also. The shampoos which they market as anti-hair fall shampoos.
Yes, it's so expensive.
So just remember that it's mainly for cleansing the hair. So it's not going to stimulate the hair growth or stop the hair fall, which has already been occurring. So that's what we need to identify the cause and treat it. That's very important. So nutritional deficiency is one which can be treated, identified and treated. And another cause is hormonal. Again, commonly PCOD, like I mentioned. Patients with polycystic ovarian disease also have hair fall. And another common condition associated with hair fall is thyroid disorders. Hypothyroidism. We have many patients who are suffering from thyroid disease. So they come with the thinning of hair and scalp. I mean, hair loss in the scalp. So again, we'll have to identify. Many patients get diagnosed based on the hair fall. They may not be aware that they're having thyroid. Only when we do a workup for the hair fall, we identify that they're having some underlying thyroid disorder. And one of the questions which we ask the patients when they come with hair fall, especially these females in the reproductive age group, whether their cycles are regular. So if hair fall associated with irregular cycles, pimples, all these together points out to probably an underlying diagnosis of PCOD. So again, that has to be treated for the hair fall to recover. So this is a second common problem which we see, hormonal cause. Then another thing, very important common cause which we see is this acute hair loss known as telogen effluvium. So any form of stress to the body, it can be mental stress, physical stress, or any kind of illness or infection in the past 6 to 7 months. Like post-COVID, many people were suffering from hair fall. So any viral or bacterial acute infection like dengue or malaria, in the last 6 months, if the patient has had any infection, the body's stress response will get activated and that will affect the hair cycle also.
Okay.
So hair fall, you will notice the hair fall after 6 months.
Okay.
So usually if you're having probably if a person is having dengue or COVID infection now, 6 months later they'll start suffering from hair fall, that is diffuse hair loss. So that is what we call as acute stress which results in hair fall, that is called as telogen effluvium.
Okay.
Again, that you need not even worry about it. This is
Okay.
something which has a very good prognosis.
Okay.
As in once, because the body is trying to adjust to that stress which it has been which it was facing.
Okay.
So as a response to that, you feel you have some amount of hair loss.
Okay.
Within 6 to 9 months period, that hair fall will recover.
Okay.
Automatically on its own, the hair growth will occur.
Okay.
We can give some topical lotions and oral vitamin supplements to fasten the process, to hasten the process of hair degrowth.
Okay.
But this COVID-induced hair fall and all that is in most cases, I'm not saying all cases, in most cases it is temporary, and you can expect a recovery within a year, at the year to 1.5 years at the most.
Okay.
Very few percentage of patients can go in for prolonged hair fall after this infections and disorders.
Okay.
So in them, to hasten the process, we may give some topical lotions like I mentioned.
Yeah. Okay.
But most cases what happens is they start having this hair fall, patients get very stressed. That stress itself increases the hair fall again.
Yes.
Again they get more stressed because of the hair fall, so it becomes like a cycle.
Yeah.
So you need to understand why you are having that. Yeah, exactly.
Yeah, they need to balance
So,
all the nutritional diet and proper routine, hair care, and both psychologically also.
Yeah, so that's very important because everybody is very concerned about the hair. It adds to the beauty, their look, and it's something visible. So any small amount of hair loss also, people start panicking, they start getting stressed. I have seen many patients who have been psychologically depressed because of hair fall.
Yes.
It is something which can be treated. You need to consult a doctor and identify the cause and then take the appropriate treatment. But again, like I mentioned, it takes time because the hair is cycle, a specific period is there. You need to give time for the hair to recover from that stress which it has undergone, come back to the normal self, and it has to start regrowing at that normal rate. So for that, you need to give it some time. So like you mentioned, it is multiple factors are involved in this.
Yes.
So you need to understand, but basically if you understand the reason why you're suffering from the hair fall, it makes the process of recovery much more easier. At least the stress part will come down. Because if you're going to keep getting stressed about the hair fall, thinking that you're having so much hair fall, it's not going to help in the recovery. That stress will again add on to the further hair loss also. So that is very important. This is a stress-induced hair loss which I mentioned. And apart from that, we have many who are taking, girls especially, they're doing this chemical hair straightening, chemical treatments for the hair. So it depends. Again, there are many types of chemicals, keratin treatment. There are so many treatments available. So the normal hair straightening treatments, which uses formaldehyde-based creams, that can also cause hair fall. Again, that is one of this cause for this acute hair fall, which I mentioned. Like immediately after straightening, they may not have. Maybe 3 to 4 months later, they'll start having. So that is something again they have to look into. Another common problem, especially in males, we see both boys and adult males, is this hormonal hair fall. That is, they commonly complain that their hairline is receding. So what was previously here, it has come up. And for them, the V shape here, you see the hairline will be receding.
Yes.
Females, it is usually a straight line. But for males, if you see, it will be the temporal area, the sides, there will be some recession. So to an extent, that is normal. A mild degree of recession is normal because the testosterone, it is hormonal again. The hormonal profile in males and females is different. So it is mainly because of the action of the hormone testosterone, they may be having that kind of an hairline. But once it starts receding and they start having less density of the hair, especially in this area, it means that you need to start taking treatment. So that is what we call as androgenetic alopecia. So it is mainly hormonal. It's not like they're having hormonal imbalance. It is just that their receptors for the hormones in the hair follicles are more sensitive. So they are developing, even for the normal level of hormone in the body, they are developing this response as a hair fall. So we need to identify that. And most commonly it is associated with a genetic etiology. So if you see their fathers, their grandfathers, their brothers may be having this baldness history in the family. Mothers may also be having. So some family history will normally be present. So some genetic factor is also included in that. So in males, especially when they are suffering from this type of hair fall, this can occur in females also. It is called as female pattern baldness, but it's more common in males. So thing is, they have to identify it earlier and start treatment. So we have topical lotions for it, which they have to use continuously for prolonged period of time, again to see the effect. So this lotion, what it does is, first it will stop the hair fall. Whatever hair fall is occurring, it will stop it. So that has to be stopped, because this is a progressive condition. Otherwise, if it keeps going, it will may result in baldness. So earlier the treatment you start, the better it is. So once you start using the lotions which we give, initially it will stop the hair fall, and then it will start, it will promote the hair growth.
A new growth.
So it takes time. It takes at least 6 to 9 months time minimum to start seeing the effect. And you should not suddenly stop using this cream also. This lotion. It's called as minoxidil. That is what commonly we prescribe. So again, percentages are different. There are formulations are different. You have alcohol-based, non-alcohol-based formulation, foam-based therapy, combination with other medicines. So depending upon your scalp and your individual basis, the doctor will decide which one to be used and which is comfortable for you to use. So again, you need consistent treatment with this. Consistently, you need to use it daily or twice daily as advised for a long period of time. Because if you do not treat at this earlier stage, later on what happens is all the follicles will start becoming smaller in size. It's called miniaturization of the hair. So a normal black thick hair starts becoming very small. You see this thin body hairs, no? Like that the scalp hair becomes. So that becomes a very difficult to reverse that process. So ultimately the last option they will be left with will be hair transplant. So we don't want it to go to that stage. So earlier you identify it and earlier we treat it, it's better. And apart from this, we have a new treatment which everybody I think will be aware of. It's called as PRP. Platelet-rich plasma therapy. Where your own blood is drawn, we collect your own blood, we centrifuge it, and we separate the growth factors, platelets. So the growth factors which are necessary for hair growth, and we inject it on the scalp. So along with monthly once, usually we do that. So that along with this topical creams will definitely play a good role and improve your outcome. Rather than using separately. So PRP actually works. There are other growth factor concentrates. Many topical injectable products are being developed every day. And this growth factors will definitely stimulate your hair growth also. So many males, I find many males coming and saying they are not, their marriage is getting affected because of this hair loss. That, they are having low self-esteem because of that. Because of the genetic factors, even at a young age, maybe 25 to 30 only, we are seeing patients with this androgenetic alopecia. So it is affecting their self-esteem a lot. So that is why initially, if you identify that you're having this kind of androgenetic alopecia, better you consult a dermatologist and start treatment sooner, so that at least we can prevent the further hair loss and the worsening of the condition. So apart from this, in males also you can have this stress-induced hair loss, like I mentioned. Any males suffering from any fever or illness, stress, even that can aggravate. So even androgenetic alopecia, if they're having, like I mentioned, they are all having low self-esteem, depressed and stressed about it. That can also further aggravate the hair fall. So proper counseling is needed. You need to identify what is the underlying cause for your hair fall. And in most cases, it is treatable. If it is not, if it is a permanent, then again, even then you'll have to take treatment to stop the disease process as such. So because otherwise the last resort which we have is only wigs and hair transplant. And even for hair transplant, not everybody is a candidate. You need to have good hair density behind. This is the occipital region. So usually there the hair will be spared. So the density of the hair follicles in that region should be certain amount, should be good enough so that the transplantation, usually they'll transplant the hair from the back to the front of the scalp.
Okay.
So that density should be good. Only then you can go in for hair transplantation also.
Yes.
So again, that cost factor is there, and it will, but it is a good option if you are in the last stage of baldness, where
Okay.
we cannot do much with just medical treatment alone.
Okay.
So
Okay.
apart from this, tablets are also available, certain hormonal tablets. But then again, it depends on whether you are married, whether you're completed your family. So all that factors will be discussed with by the doctor, and if necessary, it can also be started.
Okay.
But whatever it is, basically, it is better that you consult a doctor as soon as possible
Earliest.
and start required treatment, unless to prevent it from resulting in more baldness.
Okay. So there is another misconception going around, that is a gray hair. Gray hair, after the hair gets gray, that is premature gray hair, can be reversed back to the black hair.
Can be? Sorry?
That is premature gray hair, ma'am. It can be reversed back to the black hair. There are products selling in the market. So,
See, again, till now it is a mystery even to us. There are so many theories as to why we are having graying of hair.
Okay.
One, aging process is there. Plus other is oxidative stress is one of the reasons why they're giving. That is mainly because of stress. So this reactive oxygen species, they are getting released and they're damaging. Another thing is vitamin deficiencies, especially folic acid, B12 deficiencies, copper deficiency, zinc deficiency. So these are some of the minerals which are very important in the pigmentation.
Okay.
So in the deficiency of this protein deficiency, so these are the common theories regarding the causes for premature graying of hair. So if at all you are suffering from any of these deficiencies, it's worthwhile giving the nutritional supplement and seeing whether it is improving or not.
Okay.
And there is another misconception that if you drink tea and coffee, you get graying of hair.
Yeah.
So I see many patients who are saying they are avoiding tea and coffee.
Mm-hmm.
So it's not, there is no evidence to support that it is because of drinking tea and coffee. So again, that we cannot tell for sure. But there are few supplements like a calcium pantotheniate, which has been marketed for reversing the graying of hair. Okay. And again, what happens is the hair which has already become gray, it is difficult for it to turn black. Yeah. Once that gray hair falls off, probably the new hair which is growing in that area will be black. Yeah. This is how these treatments work. Okay. But again, there is no 100% results in all the patients. Okay. So there are topical sprays and serums which are being marketed. Okay. But again, even if you read it properly, none of them can claim 100% it is effective. Yeah. They say you need to use it for 3 to 6 months. At least 30% improvement will be there. But how do we assess whether that 30% improvement is there or not? We cannot keep counting all the gray hairs. Yeah. So again, in some patients say it works, but whether it is because of that topical cream or whether there are other dietary modification, probably they have been taking the nutritional supplements and their stress has also reduced. Whether it is because of that, it's difficult to say. Okay. But it is worthwhile trying. What I personally feel is there is no harm in trying. It's not going to have any side effects. Yeah. So if the company claims that at least 30% they are able to reverse as in the new hair which is growing in the place of the gray hair may be black. That is what many of them claim. Okay. So it can worthwhile trying, but the thing is the cost is high. Yes. So I feel that personally we can first treat the nutritional deficiency, modify the lifestyle modifications, reduce the stress, have adequate sleep, adequate hydration, treat all that. And even in spite of that, if there is still a graying of hair, then we can go in for the these topical creams, lotions, which they are selling. Okay. And one more thing is hair dyes. Because of this graying, many patients use hair dyes. So again, there is one important factor is there is a lot of misconception that ammonia-free hair dyes are safe. Yes. So ammonia is not the only agent which causes allergies. There is something called PPD. Okay. It is called as paraphenylene diamine. So if you see in the ingredient, it will be mentioned. PPD will be mentioned. Okay. That is the most common sensitizer which causes hair dye allergy in many patients. Okay. Most patients who use hair dyes are having allergies because of this PPD. Okay. So they are just because they put a label in the front saying no ammonia, it does not mean it is safe.
Yes.
If you see all the products which claim that they're having no ammonia will be having PPD.
No.
So there is a misconception that if you use ammonia-free hair dye, it is safe.
Okay.
I'm not saying everybody will develop an allergy to it, but if you are using a hair dye and you're having itching of the scalp, oozing from the scalp, face pigmentation, so that means you're allergic to that hair dye. So you need to stop it. So in those cases, you need to stop all the hair dyes because many of the hair dyes available in the market contain this PPD. So again, that is a marketing gimmick. They say no ammonia. Ammonia-free hair dyes are safe. Ammonia-free hair dyes are not safe. Ammonia-free and PPD-free may be safe.
Yeah.
Because PPD is an important sensitizer. So you need to look into the label to see if PPD is there or not.
Okay.
So that is another important misconception which is going on.
Thank you so much, ma'am. So it was so useful. So thank you so much for spending a valuable time with us. I hope this would create much awareness among people, ma'am.
Yes. Okay. Thank you so much to the LMOS team for giving me this opportunity. Because I hope through this we can create more awareness, especially among the public, about the common skin diseases. So that they seek the appropriate and adequate treatment, which will help in the
as early as possible. It can be intervened.
Yes.
Yeah. Okay.
Yes, and also the misconceptions surrounding many of these skin problems. I hope that this reaches everyone, and they are able to take adequate precautions and treatment as soon as possible.
Yeah. Thank you. Thank you so much.